I want you to do something right now. Swallow once, just once, and notice what you feel at the back of your throat. Is there something sitting there? A thickness? A coating that just will not go away, no matter how many times you clear your throat this morning. Now here is what I want you to think about. You have probably been clearing your throat dozens of times every single day. And if I asked you when it started, you might not even be able to give me a clear answer. It crept up on you slowly. First, it was just mornings. Then it was all day. And now it is just part of your life. You carry water everywhere. You avoid certain foods. You have probably tried every home remedy your neighbors and relatives could suggest. And yet here you are. Here is what I need you to hear. That mucus is not random. It is not simply your age catching up with you. Your body does not do things randomly. Every persistent symptom is your body's way of communicating something specific. The question is whether you know how to listen. And today, I'm going to teach you how. If any of that sounds familiar, I want you to know something important before we go any further. You are not imagining this. You are not just getting older, and you are not alone. I hear versions of this same story every single week from people who are tired, a little embarrassed, and honestly, a little worried. Because clearing your throat in the middle of a conversation, or waking up feeling like you swallowed glue, chips away at your confidence in ways that people who don't experience it will never understand. Maybe you've stopped speaking up in meetings because your voice cracks. Maybe you keep a water bottle in every room of your house like a security blanket. Maybe you've quietly wondered if something is seriously wrong and been too nervous to ask. Whatever your version of this looks like, I want you to settle in, because by the end of this video, you are going to understand exactly what is happening inside your body, and more importantly, exactly what to do about it. My name is Dr. Adrian Calloway, and I'm the host of Dr. Adrian Calloway Vertical Bar Advanced Health, where I work in preventive medicine and healthy aging. In my practice, I have seen this particular symptom, persistent throat mucus, misunderstood and mismanaged more than almost any other complaint that walks through my door. People are handed lozenges. They are told to drink more water. They are dismissed with a shrug and a "that just happens as we age." And the actual cause sitting quietly underneath everything never gets addressed. Today, we are going to change that. I'm going to walk you through 5 specific, research-supported causes of persistent throat mucus in adults over 55. And I'm going to do something that most videos on this topic never do. I'm going to tell you which 2 of these causes are almost certainly working together in your body right now, because they very often do, and how that combination makes everything dramatically worse. Before we go any further, drop a comment below and tell me this. Is your throat mucus worse first thing in the morning, or does it stay with you all day long? Because your answer to that one question actually tells me quite a lot about what might be driving this in your body. Write morning or all day in the comments. I read every single one. Now let's get into the biology, because there is one piece that almost nobody has ever explained to you properly, and it changes everything about how you understand this problem. Your body produces mucus every single day, non-stop, around the clock, and that is completely normal and completely healthy. Mucus is your body's protective coating for your airways. It traps bacteria, dust, and viruses before they can settle deeper into your lungs. It keeps the delicate tissue lining your throat moist and resilient. Without it, your airways would dry out, crack, and become vulnerable to every pathogen you encounter. So mucus itself is not the problem. The problem is what happens to that mucus as we get older. Here is something research has confirmed clearly, but that most people are never told in a routine doctor's visit. There is a system in your body called mucociliary clearance. Your airways are lined with millions of microscopic, hair-like structures called cilia. Their job, performed millions of times a day without you ever noticing, is to sweep mucus upward and outward so it never has a chance to accumulate. In a younger adult, this system works quickly and efficiently. But studies confirm that as we age, these cilia slow down. They beat less frequently, and the result is that mucus, which would have been swept away in seconds at age 40, can sit and pool for hours at age 65 or 70. Practically speaking, this means any factor pushing your body toward extra mucus production is going to hit harder and last longer in an older adult than it would in someone younger. That's not a complaint about aging. It's simply physiology, and understanding it is the foundation for everything we're about to cover. So, with that groundwork in place, let's talk about cause number 1. And I want you to really listen here, because research consistently shows this is the single most frequently missed explanation for persistent throat mucus in this age group. It's called laryngopharyngeal reflux. You've probably never heard that term, so let me put it in plain language. Most people know classic acid reflux, that burning feeling in the chest after a heavy meal. But there's a quieter, sneakier version of this problem. No burning. No obvious digestive discomfort at all. Just a throat that will not settle down. Here's what's happening. Where your esophagus meets your stomach, there is a muscular ring, a valve, whose entire job is to stay shut after you eat so stomach acid stays where it belongs. As we age, that valve can lose tone, a bit like a rubber band that's been stretched one too many times. When it doesn't close all the way, stomach acid travels upward, not just into the esophagus, but all the way into the throat, the voice box, and sometimes even the sinuses. And here's the detail that matters most. The tissue in your throat isn't built to handle acid the way your esophagus is. Even a tiny trace of it triggers an immediate protective response, and your body rushes to produce thick mucus to coat and shield that irritated tissue. That's logical biology. But when this happens night after night while you sleep, you wake up every single morning to that familiar heaviness at the back of your throat with no idea why, because there's no heartburn, no chest pain, nothing pointing toward your stomach at all. Clinical ENT research shows that up to half of people with this condition report no heartburn whatsoever, just chronic throat clearing, a rough morning voice, and mucus that starts building the moment they wake up. Ask yourself honestly, is your throat significantly worse in the morning than later in the day? Does it get worse when you bend forward? Has your voice sounded different right after waking up? These are the fingerprints of silent reflux, and I'll give you a specific action plan for it in just a moment. One more thing worth flagging here. If you regularly take anti-inflammatory medications for joint pain, like ibuprofen or naproxen, peer-reviewed research shows this class of medication weakens your stomach's natural protective lining, making acid reflux, including the silent kind, significantly more likely. If that's you, please bring that connection up with your doctor by name. Before we move on, take a second and tell me your name and where you're watching from. I go through the comments, and I genuinely want to know who I'm speaking with. Because number 2 tends to arrive quietly and stay unnoticed for exactly that reason. When people picture sinus problems, they picture the dramatic version. Intense facial pressure, a throbbing forehead, a completely blocked nose. But in many adults over 55, chronic sinus inflammation shows up almost invisibly. Breathing feels mostly fine. There's no real headache, yet the sinuses, mildly swollen and producing a little more mucus than normal, are draining steadily and silently down the back of the throat all day long. This is called postnasal drip, and a 2024 study found the average age of patients presenting with it is exactly 55. That is not a coincidence for this audience. Here's the frustrating part. Many people dealing with this have been taking over-the-counter antihistamines for months, assuming it's seasonal allergies and wondering why nothing changes. Antihistamines dry the mucus temporarily, but they do nothing for the underlying inflammation causing the extra production in the first place, and dried, thickened mucus stuck at the back of your throat is often more uncomfortable than what you started with. The strategy with the strongest research support is simple and inexpensive. Regular nasal rinsing with a warm saline solution. A 2025 clinical review in the journal Medicina, surveying evidence across a wide range of sinonasal conditions, concluded that nasal irrigation is an effective, safe, low-cost strategy for treating and preventing upper respiratory tract issues, and it's widely used as a supportive treatment by ENT specialists around the world. High-volume saline rinses work by physically flushing out inflammatory mucus, calming mucosal swelling, and improving that ciliary clearance system we discussed earlier, the very system that naturally declines with age. The single most important word in all of this is consistency. 1 or 2 uses gives you a day or 2 of mild relief. Daily practice, done correctly, produces real, cumulative improvement, and I'll walk you through the exact method shortly. If you're finding this helpful, type the number 2 in the comments so I know you're still with me. And if you haven't subscribed yet, please do. It genuinely helps this channel keep going. Because number 3 tends to catch people off guard more than any other, because when we start talking through what might be behind their throat symptoms, their own medications, the ones they've taken faithfully for months or years, are simply never something they think to question. There's a class of blood pressure medications called ACE inhibitors, angiotensin-converting enzyme inhibitors, prescribed millions of times every year. They're effective, generally well-tolerated, and serve a genuinely important purpose. But they carry a well-documented, class-wide side effect. They allow a substance called bradykinin to build up in the body, and in a meaningful proportion of people. Studies report somewhere between 5 and 20% of users. That buildup triggers persistent throat irritation and an ongoing urge to clear the throat. This is not an allergy, and it's nothing unusual happening in your body. It's simply how the medication works, and your throat happens to be sensitive to that effect. Here's the detail that causes this connection to be missed so often. The side effect can take weeks or even months to appear after you start the medication. So if you began a blood pressure pill 8 months ago and your throat started bothering you 6 months ago, you may never have connected those two events. But that timing lines up exactly with what the research describes. A large study of more than 27,000 patients found adults over 65 had 53% higher odds of experiencing this exact throat side effect compared to younger patients. That is directly relevant to you. If you take a blood pressure medication and you're not sure which class it belongs to, your pharmacist can tell you in under a minute. And if it turns out to be an ACE inhibitor, there are alternatives. ARBs, angiotensin receptor blockers, that control blood pressure just as effectively without this particular side effect. That's a conversation worth having with your prescribing doctor. If you're still watching, type the word clarity in the comments, because that's exactly what I want this video to give you. Because number 4 surprises people not because it's complicated, but because they dismissed it as too obvious to matter: hydration. But let me give you the actual physiology here, because it's not what most people assume. Your mucus is mostly water, and its consistency, thin and fluid, or thick, sticky, and hard to move, depends directly on how well hydrated the surrounding tissue is. Picture maple syrup fresh out of the bottle versus maple syrup that's been sitting open overnight. Same substance, completely different behavior. Your mucus works the same way, based entirely on your hydration status. Here's the age-related wrinkle that makes this more than a generic reminder to drink water. Research has clearly established that the thirst mechanism becomes significantly less reliable as we age. A younger adult feels thirsty well before they're meaningfully dehydrated. In older adults, that early warning system is blunted, which means you can be dehydrated enough to noticeably thicken your mucus and affect your daily comfort without ever feeling particularly thirsty. Waiting for thirst to prompt you to drink means you're consistently running behind. And mild dehydration, maintained day after day, keeps your mucus persistently thick and sticky in ways that amplify everything else we've talked about today. A practical target referenced widely in clinical nutrition guidance is roughly 30 milliliters per kilogram of body weight per day from all sources. Water, herbal teas, soups, and water-rich foods all count. The key isn't drinking a lot at once. It's deliberate, steady intake throughout the day, not catching up only when you feel thirsty. If this is helpful, type the number 4 in the comments, and if you haven't subscribed yet, hit that button and the bell so you don't miss what's coming. Because number 5 almost never gets discussed in videos like this one, and I think that's a real gap, because for a meaningful portion of older adults dealing with persistent throat mucus, the root of the problem isn't in the throat, the sinuses, or the stomach at all. It's in the gut. Here's what the research shows. Your digestive tract and your respiratory system share regulatory pathways through the immune system and the nervous system. The health of your gut microbiome, the trillions of bacteria living in your intestines, directly influences how reactive and inflamed your upper airways become. When that microbial balance is disrupted, a state researchers call dysbiosis, it can trigger immune responses that promote excess mucus production in the airways. Not because anything is physically wrong with your throat, but because your gut is sending inflammatory signals that your respiratory system is responding to. This connection, sometimes called the gut-lung axis, is an active and growing area of clinical research. Multiple peer-reviewed studies, including work published in the American Journal of Respiratory and Critical Care Medicine and the Journal of Allergy and Clinical Immunology, have confirmed that gut microbiome disruption can trigger immune responses that drive airway inflammation. Animal studies have gone even further. When mice received gut microbiome transplants from patients with chronic lung disease, those mice showed measurably increased airway mucus production, demonstrating a direct causal link between gut health and what happens in your airways. What disrupts the gut microbiome in older adults? A diet low in fiber and fermented foods, repeated courses of antibiotics over the years, high sugar intake, and chronic stress. None of these are exotic. They describe the everyday reality of a very large share of adults in this age group. You won't fix a gut airway problem with a throat lozenge, but you can absolutely begin supporting your gut microbiome with consistent daily choices, and I'll include exactly how in the action plan. Before I give you that action plan, I want to take a moment that genuinely matters. Most of the time, persistent throat mucus in older adults is benign, exactly the kind of manageable, addressable, not dangerous situation we've been discussing today. But sometimes your body uses a symptom to signal something that needs professional attention rather than self-management. Please make an appointment with your doctor promptly if you notice any of the following. Mucus consistently tinged with blood, even a small amount. Difficulty swallowing that is gradually getting worse. Unexplained weight loss alongside your throat symptoms. A lump or persistent swelling in your neck, or a significant voice change that isn't improving. These signs go beyond the scope of today's conversation, so please don't try to work around them. Bring them straight to your doctor. Now, for the action plan, the part where everything we've covered turns into something you can actually do. Tonight, stop eating at least 3 full hours before you lie down. When you eat and immediately recline, your stomach is still hard at work, and that valve we talked about earlier has its hardest time staying closed. 3 hours of upright time after your last meal is one of the most well-supported behavioral steps for reducing nighttime silent reflux. Elevate the head of your bed slightly, not with extra pillows under your head, which just bends your neck uncomfortably, but with a firm wedge under the headboard legs or mattress. Even a few centimeters of incline lets gravity work in your favor and meaningfully reduces how much acid can travel toward your throat while you sleep. Before bed tonight, drink a full glass of warm water. This simple habit supports overnight hydration and helps keep mucus thinner, so morning accumulation is less severe. Tomorrow morning, before coffee, before breakfast, drink 1 to 2 glasses of plain warm water. This costs nothing, and it immediately begins rehydrating your body and loosening the overnight buildup of mucus before it takes over your whole morning. It's one of the most consistently reported, high-impact changes people make. This week, pick up a nasal rinsing device from your pharmacy, a neti pot or a squeeze-style bottle. Use water that's been boiled and cooled to a comfortable warm temperature, never straight tap water. Add a small pinch of plain salt, and optionally, a very small pinch of bicarbonate of soda, which may help thin mucus by gently neutralizing nasal acidity. Use it once daily, ideally in the morning, and give it a full 2 weeks of consistent use before you judge whether it's working. Consistency is what separates the people who say it worked from the people who say it didn't. Book an appointment specifically to review your medication list against your throat symptoms. Come prepared with a simple timeline, when your throat symptoms started, and when you last started or changed a medication. If you take a blood pressure medication, ask directly whether it's an ACE inhibitor and whether an ARB alternative might be appropriate for you. To start supporting your gut-airway connection, add 1 small daily serving of a fermented food to your routine. Plain yogurt with live cultures, kefir, a small portion of kimchi or sauerkraut. These choices help diversify and support your gut microbiome in ways research links to reduced airway inflammation over time. This is a long-term strategy, not an overnight fix, but long-term strategies are the ones that actually shift your baseline. And finally, set hydration reminders. Keep water accessible in every room you spend time in, and eat more water-rich whole foods. Cucumbers, watermelon, soups, herbal teas. Your mucus will thank you within days. One quick word on popular home remedies, because I know you've tried a few. Honey is genuinely soothing for irritated throat tissue. It's not harmful and can calm symptoms temporarily, but it doesn't address any of the 5 causes we discussed today. Dairy doesn't create mucus out of nothing. The science doesn't support that claim, but some people find dairy proteins make existing mucus feel thicker. If you notice a consistent pattern, a 2 to 3 week reduction trial is a reasonable thing to try. Apple cider vinegar is a popular online suggestion, but if you have silent reflux, adding more acid into the system can actually make things worse, so please be cautious there. Here's what I want you to walk away with today. That persistent mucus coating the back of your throat has a reason. 5 possible reasons, actually, and most people living with this have never had a single one properly explained to them. Silent reflux happening quietly while you sleep, with no heartburn to warn you. Postnasal drip from low-level chronic sinus inflammation that never announces itself dramatically. Medication-related throat irritation, specifically from ACE inhibitors, developing months after starting a medication and never getting connected to the real cause. Chronic mild dehydration, running just below the level that triggers obvious thirst. And gut microbiome disruption, sending inflammatory signals your airways are simply responding to. None of these require you to accept a life of constant throat clearing. Each one has a practical evidence-grounded response, and none of the first steps require a prescription or a specialist. They require some knowledge, some consistency, and a willingness to treat your symptoms as a signal worth responding to, rather than a nuisance to just manage. If someone has ever told you this is just getting older, I hope today gave you a different lens, because you are not just aging. You are dealing with specific, identifiable, addressable physiology, and you deserve to know that. Make sure you're subscribed here on Dr. Adrian Calloway, Vertical Bar Advanced Health, and turn on notifications, because I have a video coming very soon on exactly how gut health connects to the chronic inflammation patterns behind some of the most common complaints I hear from adults in this age group. That's a conversation you won't want to miss. If this video gave you something genuinely useful today, would you consider sharing it with one person who's been quietly dealing with this same problem? That one share costs you nothing, and it could genuinely change how that person understands their own body. And before you go, tell me in the comments, which of these 5 causes surprised you the most, and how long have you been dealing with this? I read every comment personally. This is a real conversation, and your experience matters here. Take care of yourself. I'll see you in the next one.